reconfirm for folks.
All right, again, everyone, we will continue to listen in to Fox 5 New York segment here in just a bit on News Now from Fox, but we have another live interview that we want to get to as soon as possible. I am currently joined by Dr. Amesh Adalja. He is from Johns Hopkins Bloomberg School of Public Health. Good morning, doctor. How are you doing? And thank you so much for joining us here on News Now from Fox.
I'm doing well. Thank you for having me.
All right, so we just talked to Dr. Mike Sirigliano. A lot of people are hopeful that this is the beginning of the end of the pandemic. Where do you think we stand here with COVID-19?
I think it is the beginning of the end, but there's still a long tunnel that we have to traverse because we have the solution at hand. We have this vaccine that really has excellent results. But the problem now is turning that vaccine into a vaccination, and that's going to take some time. So I do think we're going to see for the next several weeks more deaths and more hospitalizations. Once we start to get the vaccine into the vulnerable populations, nursing home residents, community dwelling, elderly, and high-risk individuals, we'll start to see hospital numbers drop and deaths drop. But we're still going to see spread for some time, probably until the summer before we get some control of the community level spread. But I think people's risk perception will change once the hospitals are able to kind of breathe a little bit.
What are your thoughts that we might have an annual COVID-19 vaccine? Do you see that coming kind of like a flu shot?
I think it's too early to say. Remember that we do the flu shot every year, not because of something that's changed. It's because the virus changes in a way that's very different and very unique to influenza. It's almost a whole new vaccine that we get. And we haven't seen those kind of wholesale changes with COVID-19. We've seen variants arise, but we see that the vaccine still works pretty robustly against those variants. So it may not be that it's yearly, it may be a longer period of time, or it could be because our immunity drops and we need a booster shot, the same way we get 2 doses of the measles, mumps, rubella vaccine. But we need to wait and see exactly how people who were vaccinated very early on, how they do, what happens to their antibody levels, what happens to their T cells, do they get reinfected, and then we'll make that decision of what the interval might be or if the vaccine needs updating.
We've got a new administration in the Capitol. We have President Joe Biden now in office. He put out some executive orders to expand testing. What are your thoughts on that?
And this is something that's long overdue. Since the very beginning of this pandemic, we've had a problem with testing. It's been very difficult to get tests. Even in the last month or so, I've had colleagues and friends having a hard time getting appointments to get tests as outpatients. We've gotten the inpatient testing problem fairly solved. But the fact is, we want to be able to test for this when we brush our teeth, so we know whether or not we're contagious to others that day. And we do have some home tests, but we need more of them and we need more funding. This should be something seamless, that it should be easy to do and can be done at the drop of a pin. And it's still not that way. We can't test in the United States in January of 2021 the way probably Taiwan could do in January of 2020. So I think we really need to get testing to a point where we can do this as simply and as easily as possible, so everybody can have a pack of home tests in their home and do this every day before they go out.
We've got the Moderna and Pfizer vaccines already making their rounds across the U.S. Both of them require 2 doses. What are your thoughts on, I believe it's AstraZeneca and Johnson & Johnson, who currently have 1 dose trial studies going on right now?
Well, the Johnson & Johnson vaccine is looking very promising. We've seen phase 1 and phase 2 clinical trial data. We're waiting for phase 3 data, and this is an interesting vaccine because it does only take 1 dose, which makes it very, very easy to administer. Anytime something is more than 1 dose, compliance goes down, people forget to come back, people don't want to come back because of the side effects they had after their first dose, and it's logistically challenging. The AstraZeneca vaccine is a 2-dose vaccine, although they're studying single-dose regimens, but really that's another vaccine that's approved already in the United Kingdom. It will probably be coming into the United States probably late spring because they've had some issues with their clinical trials. But the more vaccines we have on the market, the more of a menu we have, the better it is going to be, because we need to do a lot of vaccination. We need 300 million plus people to be vaccinated with a 2-dose regimen versus a 1-dose regimen. That's a big difference. So I do think that having as many vaccines out there is going to make everybody's job easier when it comes to getting this vaccine into people's arms.
Yeah, here in Central Florida and cities and counties and states across the country, they're just having a hard time with administering these shots because they're not getting them, or it's just not quite as organized. Do you think we need a federal organization plan for this?
Not every state's been able to do well with this vaccination campaign. We've seen some like West Virginia really be able to do this, but not everybody can. And I do think there had been a real lack of federal leadership when it came to this last mile of vaccination. There was a lot of emphasis placed in Operation Warp Speed on developing the vaccines, and they were a smashing success. To have vaccines approved within 1 year is really kind of unprecedented. But a lot of us were advocating for the fact that when we actually had to turn these vaccines into a vaccination program, there were going to be problems. We saw this back during the pandemic in 2009 with H1N1, because states and state health departments are under-resourced and unable to really do this. And at the same time that they're being asked to set up vaccination clinics, they're doing testing, they're also doing contact tracing, and they just don't have the resources. And the bill that gave them funding was only signed over Christmas weekend, already after vaccine rollout had started. So it is going to take some time, but I do think federal leadership, using FEMA, the National Guard, having the CDC help with best practices and meeting states where they are, because each state may need something different, is going to be a way to accelerate this, because we really have to remove all the speed limits on this vaccination and just move as quick a pace as possible, because the faster we get vaccine into people's arms, the faster this pandemic is over.
Yeah, how can we safely reopen businesses and schools? Many are still closed. How do we get back to the normal that we remember from January of 2020?
The best way to get back to normal is to get vaccine into people's arms, and then also have the CDC being able to speak very frankly to the American public with guidance on how do you open a certain business, how do you open a school, what are the measures that need to be put in place, what are the best practices. Some of these things have already opened. So for example, in some parts of the country, in some cities, schools are open, and in other parts they're not. What can we learn from the schools that are open to make them as safe as possible? There is a way to do all of this, but it is going to include vaccination. It's going to include some modification of operations, and people realizing that we're still in a pandemic and you have to behave like you're in a pandemic, which means following those common sense recommendations of wearing a face covering, washing your hands a lot, and avoiding crowded and congregated places, trying to stay 6 feet apart. This can all be done, but we actually need to have the will to do it.
All right, Dr. Adalja with the Johns Hopkins Bloomberg School of Public Health. Johns Hopkins has been in the public eye worldwide due to keeping tabs of the coronavirus cases. So thank you so much for joining us here on News Now from Fox.
Thank you for having me.
We're taking a live look now at Port Canaveral, Florida, a Disney cruise ship. Most of you are going to see a 2-minute commercial break. When you return, Rain Augustine will be your host for the next couple hours. I will rejoin you from 10 a.m. to 11 right here on News Now from Fox.